Hi everyone and welcome to Season 2 of the Leading Beyond the Lab podcast, proudly sponsored by ARTO, the competitive edge for life sciences talent. I'm your host, Lawrence Rose, and our mission is to shine a light for aspiring scientists and physicians looking to understand what life's really like in the pharmaceutical sector. In each episode, we dive into the stories, insights, and valuable lessons learned that have propelled our guests to remarkable success and impact within their respective disease areas. In today's episode, I'm really excited to be joined by Frank Watanabe, a true titan of industry and president of Arcutis, one of the few commercial stage biotechs paving the way in dermatology. We explored Frank's incredible career, from serving in the Navy, where he was able to hone his leadership skills, to building a career in big pharma with Eli Lilly and Amgen, before ultimately landing in the world of biotech, where he currently leads the Arcutis story. Now, if you enjoy listening to this episode as much as I enjoyed recording it, be sure to hit subscribe because we'll be releasing new episodes each week. Welcome everybody to Leading Beyond the Lab, the podcast that provides a platform for scientists and physicians looking to join the life sciences sector. Today we're joined by a titan of industry, a real leader who's covered off and has a career that spans all things pharmaceutical industry in terms of big pharma, mid pharma, biotech and investment. I'm really pleased to have you here today, Frank. Welcome.
Thank you very much. Appreciate it.
Just to, if you'd like to get us started with an intro and we'll jump straight into your experience.
Yeah, I've been in the industry about 30 years. Started out at Eli Lilly and Company in commercial roles. I was a sales rep, a sales manager, worked in sales operations, and then I got to go overseas. Spent 5 years overseas in total, living in Europe, first with Eli Lilly, and then I moved over to Amgen. Ended up spending 9 years at Amgen, including 2 in Europe and 7 back in the States, did some U.S. marketing as well. And then I moved into product development and worked on the development of 2 of Amgen's currently marketed products, Repatha for cardiovascular disease and Aimovig for migraine. I left Amgen in 2013 and went in the startup world, joined a company called Kythera that was in the aesthetic space, was with them for a couple of years until we were bought by Allergan. And then I had another startup in the cardiovascular space. Drug didn't work, which happens in our industry.
Yeah. And 9 times out of 10.
Yeah, that's right. 9 times out of 10, exactly. And then I've been with Kythera. I've been with Arcutis almost 9 years now. Was the number 3 employee, and we built it up from 3 people to 350 over the last 9 years.
It's a real success story, the dermatology biotech scene, isn't it?
It's been an amazing ride. Yeah. We it's rare, I think, in biotech in general that it's rare for a biotech to make it all the way to FDA approval. They usually get bought, right? Yeah, that's my next question. We haven't been bought yet. And then we have 3 products now launched in a little over 3 years, which is very, very unusual in the biotech space.
So what encouraged you to not get bought and to go it alone? Because I imagine there's a lot of interest, right?
One of my mentors always says that companies are bought, they're not sold, right?
Yeah.
You never want to have a strategy of being bought, because if someone doesn't buy you, you've got a problem.
Yeah.
But if no one shows up to buy you anyway, you have to be able to do it for the long haul. But honestly, our strategy from the outset has been to build a sustainable company. There was a lot of consolidation in dermatology over the last couple of decades, and there are really very, very few dermatology-focused companies anymore. And so when we founded the company, it was really designed to fill that void, to have a company that was really dedicated to dermatology, only did medical dermatology, and to reinvigorate some of the innovation that had really fallen by the wayside in dermatology. And, we would be perfectly happy to stay an independent company as long as possible.
If you've got a good team, good people, it's enjoyable.
Great team, great people. Yeah.
Do you think your commercial background gave you, and your blended leadership roles in different regions has given you a more worldly experience or given you any edge?
I think I wouldn't say just my commercial experience. I think, my broad experience, when I was a country manager, I had medical, regulatory, legal, HR, finance, and commercial under me. Product development, I had to work with all of the various functions. So I understand a little bit of everything. I am the first person to admit that I am not the expert at the company on anything, which is as it should be, right?
Sign of a good CEO, isn't it?
You surround yourself with really good, smart people who know more than you do. But I think it does help that I understand all the facets of the business,
To an extent, I suppose, and then you can build it.
Yeah, that's right. Yeah, enough to ask the hard questions. That's how I like to think about it.
And on that journey, that global journey that you went on, which I know Lilly are quite famous for, and certainly in the past, what lessons did you learn of what really makes a good leader?
Oh, God. I would say, so I actually had a military career as well, in addition to my pharma career.
Which part of the military?
I served in the Navy for 25 years.
Nice.
I think I learned more about leadership in the military than anywhere. The military is the ultimate test of leadership.
Yeah.
Right? You're leading men and women in war in some cases, and I fought in 2 wars.
Really?
Iraq and Afghanistan and Kosovo, and then I helped plan the Iraq war in 2003. But that is the ultimate test of leadership.
Yeah.
And I think my whole leadership philosophy really stems from my experiences in the military. And I think there probably are 2 really strong lessons that I took away from that. The first one is when I was a very young junior officer, someone told me that you can demand obedience, but you earn loyalty, right? If you ever have to say, do this because I'm the boss, you've already lost the argument.
Yeah,
right?
I totally agree.
Whereas if your team believes that you have their best interests in mind and they trust you, when you say, hey, guys, I need this to happen, they will go and do it, right? And that's real leadership versus management or dictatorship, right? So I think that was one of the big lessons that I learned. The other big one, really, and I actually have a quote at the bottom of my email to this effect. George Patton once said, never tell people how to do things. Tell them what you want, and they'll surprise you with their ingenuity. And that's really central to how I run Arcutis, right? Not being the expert. It's not my business to tell the team how to do something.
Yeah.
It's my job to tell them what needs to happen and make sure everyone's moving in the same direction, and then get out of their way and let their genius, their experience, their creativity figure out how to solve the problems for us. And that's really the essence of good empowerment, I think, too, is making sure everyone's moving in the same direction, but giving them the latitude to figure out how to achieve what you want them to achieve.
With the military, it naturally associates with a more traditional hierarchy type of model.
Yep.
So how did you well, firstly, is that true? Because it might not be. And secondly, how do you then apply those concepts and then mold them into the pharmaceutical sector?
I think that the most important thing is not really that true, right? The military, yes, is a hierarchy, so are big corporations and lots of other things. But especially the U.S. military, and I think many of our allied militaries as well, practice a doctrine. We call it in the U.S. command. Shoot, now I'm gonna. It's gonna. The Navy calls it command by negation. Mission command is what the joint doctrine is for. But it really comes down to that, right? Set a very clear commander's intent for what needs to happen, and then give your teams the flexibility on how to do it. And I experienced that throughout my military career. I think back to when we were planning the Iraq war in 2003. I was working for this brilliant general, Gary Harrell. I think it was a lieutenant commander, and he was a 2-star general. And he would tell us, I need this to happen. And that was it, right? And we were just expected to figure out how to make that happen. And he would come down once a week and said, let me hear the plan. And we'd explain it to him, and he'd ask some questions. And he'd say, okay. And he would go off, and a week later he'd come back and give me the update. But he never micromanaged us, right? Yeah. And that was how he got the best out of the people underneath him. And we were fiercely loyal to him. I would have run into hail of bullets for him.
Yeah.
I remember those lessons, and I use that in my leadership in the corporate world.
Have you got any great examples of that in practice and industry?
Oh gosh, that's how I practice my business all the time, right? I tell my team, in
terms of a learning point for the listeners,
I think a good example that just recently, we launched our product about 2.5 years ago. Right. And we've established the product in the marketplace. We're a leader in our segment now, but there's this much, much larger market out there that we hadn't focused on yet. And so late last year, I pulled the team together and I said, listen, guys, we need to pivot, right? We've already won the battle against our competition, but there's this huge opportunity out here that we need to figure out how to get after it. So you guys need to go out and figure that out. And then that was it, right? That was the extent of the guidance.
Yeah.
And they're continuing to work through it, but they've already, just in the last 6 months, have made amazing progress in coming up with really innovative ideas and solutions about how we're going to attack that broader market and continue our growth forward.
Is that tackling all more indications within dermatology, rare diseases? Or?
Really, it's driving the conversion from really old, outdated therapies to these newer class of drugs. Right. We're in the dermatology space, and the standard of care for most patients has been historically topical steroids, which, are very effective drugs, but they have a lot of safety issues.
Mm-hmm.
But, dermatologists for many years, that was the only option they had. Mm-hmm. Right. And so that's what they used. Well, now it's not the only option anymore. But they still today are about 16 times more likely to be prescribed than the newer agents. We need to change that, right? And so my challenge to the team was, how do we drive conversion from steroids to these newer, safer drugs? Figure it out, right?
And that's like a behavioral, instinctive thing, I suppose.
It's a habit. Yeah, I think, the dermatologists have been using topical steroids since, their first day in residency. They know there are issues with it, but, they're just used to doing it. And, I worked in the antidepressant market when the SSRIs were replacing TCAs.
Yeah.
Very similar kind of pattern. I worked on antipsychotics when the atypical antipsychotics were replacing neuroleptics. The migraine drug I worked on is now in the process of replacing the old triptans. There's a certain therapeutic inertia in medicine. It takes a while for doctors to change over to the newer class of drugs, but it eventually happens.
It's amazing, really, isn't it? And why do you think Arcutis has been so successful and really been a commercial success?
I think there are a number of factors that have contributed to our success. I think first and foremost, we have a really great drug, right?
Yeah.
And there's a huge element of luck in that, like my last company proves, right? It was a great idea. We thought it was going to be terrific, and then the drug didn't work.
Yeah,
that's the way it goes. Yeah. I think we really hit on a jackpot with our product. It's very effective, very well tolerated. And it fits a real unmet need in medicine. So I think that's the starting point. But I think in addition to that, one of the keys to our success from the outset has been building a phenomenal team. And in particular, we have brought into the organization a number of clinicians who work in dermatology. So not just commercial people or business people making decisions, but people who actually treat the patients that we're trying to help. So at Arcutis, out of 100 or 350 people, we have 7 dermatology clinicians at the company. And a number of them still practice medicine, see patients 1 day a week. And I really encourage that because they bring insights back to us about what their colleagues are struggling with, right?
It's a really interesting insight, that, just to interject, because I get varying views on that, being in the talent side. Mm-hmm. So I know I can think of several physicians who are practicing dermatologists that when working with them on the opportunities, the role they picked was because they were unable and actually able to continue in the clinic, and because of that feedback loop that you talked about. And I think and I think if you're going to a KOL or something and you could talk about what the NHS is like, or whatever healthcare system is like, you've got that real-time information, and it's an engagement tool, isn't it, with those
Absolutely.
people?
And it cuts both ways. I think it gives our clinicians credibility with their colleagues because they're in the trenches with them, right? And it's not very common. So it's a little surprising when my chief medical officer says, I see patients 1 day a week, and doctors are like, wow, really?
Yeah.
You used to? Yeah. And on the other hand, we are bringing these insights back real time every week to our practice. And it's different than doing market research, right? Because these are clinicians who are in the trenches doing it every day, and they can come back and say, look, this is how it works in the real world, right? This is a real problem, or that's not really a problem. And then I think the third thing is, and I think this is critical for any leader, I believe that culture is really critical, right? There's an old aphorism that culture eats strategy for lunch. I think that's very true. And we have been very, very deliberate about building a certain culture at Arcutis. Empowerment is a big part of that. Driving decision-making out to information, not concentrating it all up at the top of the organization. But there are a number of facets to our culture which I think have been really critical to our success. And having the right kind of culture is what is vital, as you know, from your business, in recruiting the best people, in retaining the best people and in motivating the best people. And that's what really allows you to be successful in the end.
And what else goes into that great culture? Because that's
well, so, we actually at Arcutis have 13 operating principles that we live by.
Sounds military-like.
Well, most companies have corporate values, right?
Yeah.
I don't believe in corporate values because I don't think corporations have values, right?
In what sense?
People have values.
Yeah.
A value is a very personal, internal thing,
true.
right? But these are the operating principles are kind of like the DNA or the operating system for how we run the company, right? So, they run the gamut from, patients are paramount is the first operating principle. And, we tell the staff all the time, if you're ever in doubt about what to do, ask yourself what's best for patients. And that's probably the right answer,
that's a great
right?
assessment.
So, it just makes sure everyone's focused on the fact that we're in the healthcare industry, and you need to remember that you're treating someone's mother, someone's husband, someone's child, and you need to be thinking about the patients when you're making key decisions, from clinical development, the trials you're going to run, all the way through to how we price our drugs, right? The patient has to come first. I mentioned empowerment. Robust debate is one of our core operating principles.
Okay.
I don't believe anyone, including myself, ever has all the answers, right? So having a group of very smart people in a room debating something usually leads to the best answer. Right?
Yeah.
And we really embrace that sort of robust debate.
Without taking it personally as well.
That's right. Well, that's why
door,
respect and robust debate are both important principles, right? You can disagree on the facts, you can debate the facts, but you still have to treat each other with respect and recognize that I may think, the moon is blue, but you think the moon is gray, right? That doesn't mean that you're an idiot. We just have a difference of perspective, right? And actually, the last of the 13 operating principles is the second most important after the patients are paramount. The patient's paramount, and that is no assholes.
Yeah. Sounds like the All Blacks. I don't know if you've seen the rugby team.
Yeah. Life is just too short to work with assholes.
Yeah.
So we don't tolerate it. And
So
that is one of our corporate operating principles. And we tell people, listen, even if you're good at your job, if you're an asshole, we're gonna coach you out. It's just.
So how do you develop your spidey sense to detect that?
Well, sometimes you know it, right? But sometimes someone slips through, and then you realize it down the road, and we coach people out, and we've had to do it on a couple of occasions, and we tell them, look, you knew what the rules were coming in, and your behavior is not acceptable, and you're not really fitting in. I've had the experience too many times in my career. Where you hear, okay, yeah, he's a jerk, but he's good at his job. That's an excuse. He's good at his job, so that makes it okay to be a jerk. Yeah. No, it's the exact opposite. He may be good at his job, but he's still a jerk.
Yeah,
right.
Yeah.
He's got to go, even if he's good at his job, because one bad apple truly does ruin the whole barrel. It's just, I've seen it happen over and over again. One person can infect the entire culture of an organization, hundreds of people. And it impacts morale, it impacts productivity. You create stress in your employees, which has all kinds of deleterious health effects. It's just not worth it.
And retention goes down.
Yeah, absolutely. Yeah. Absolutely.
It's fascinating how much of an impact that one person can make, isn't it?
It really is. Yeah.
Do you ever see people turn that way through no fault of anyone's? Bad experience at home? I don't know.
I think there's a difference between bad behavior and being an asshole. Yeah. Right. We all have bad days, right? Yeah. Values, and I'm guilty of having a bad day or losing my temper, right? But when I lose my temper, it's usually after the fact that I recognize it and I think, wow, I didn't handle that very well. And I'll go back and I will apologize to the people involved and say, hey, listen, I still need this to happen, or I still am not happy about this, but I didn't treat you very well, and I'm sorry, right? And that doesn't make it okay, right? But you can at least move past it, right?
Yeah, I agree.
The real problem is when you see a consistent pattern of behavior with someone. And, when we've had these problems in the past, we've coached them. We said, listen, this is not how we roll here, right? We are not going to tolerate this kind of behavior. And if it keeps happening, then we'll let him go.
Yeah, it's fair. There's a firm boundary as well.
Yeah, absolutely.
They know where the line is.
Yeah.
Which I think drives the right behavior anyway.
Well, and I think this is something else that I think all leaders need to be really cognizant of is, and I talk about this all the time with my team. There's another old aphorism, right? That feedback is a gift. That's actually very true, right? And if you have an employee who is having a behavioral problem or a performance issue or whatever it is, as a supervisor, you have an obligation. You have a moral responsibility, I would say, to tell that person that they're screwing up, right? Because you need to give them the opportunity to course correct. And I've seen that in my career where, you really give someone a kick in the rear end, and some of them will take off, right? And they'll fix the problem that you talked about. Some of them won't. But you gave them the chance, and then you can move on and do what you need to do. But, if someone is ever surprised by being terminated, you didn't do your job as a leader.
I agree with that. That's rule number one, isn't it?
Yeah. It's really important. And I think one of my mentors is very fond of constant and continuous feedback, right? This should not be an end-of-year performance review discussion where the employee finds out that, we're not happy with your performance, right?
Yeah.
I have weekly one-on-ones with all of my direct reports. And once a quarter, we have a sit-down, a coaching session separate from the business, just to say, what's going well, what's not going well, where are you focusing? And I think having that discipline of constant feedback so that everyone knows where they stand, what they're doing well at, what they need to improve on is the best way to run the organization.
I've always found that in some ways, the hardest thing with that process is actually the implementation side. So how you at scale continue the improvement through taking, because it's you have to be very deliberate, don't you? To sit there on the Monday and think, right, what do I need to improve on this week?
Yep.
Before you know it, you've got 300 emails, this to do, mounting lists, things at home. So what have you got a process for that? Or
yeah, I do, and I wouldn't say that I invented this myself. The mentor I'm referring to is a retired lieutenant general by the name of Rick Lynch, who has written a number of books on leadership. He has a wonderful new book out called We're Not Robots. And he talks about this process in the book. He'd given me this coaching and advice beforehand. But I sit down with my team and I ask them, what's going well, what's not going well, and where are you focusing on in the next 90 days, right? Those are 3 questions. They all know those are 3 questions. I have my notes from the last time we talked, what they told me last time, right? And then I have my thoughts on what's going well and what's not going well. Ideally, what you hear from them is what you think is going well and what's not going well, right? Because then you know that they're self-aware.
Yeah.
I have another really dear friend, Bob Azelby, worked with me at Amgen, who likes to say, are you consciously incompetent or are you unconsciously incompetent, right? Do you know you're screwing up or not? And when my team says, well, I think I'm really doing well at this and I think I'm not really doing well at that, and that's what I think, then I know, okay, they're self-aware. And that's the first step, I think, in fixing what the area of improvement is. If the person says something that I don't agree with or they miss something that I think is a problem, I tell them, right? And by having this regularly and building on it, most of the time, the areas of strength and the areas needing improvement are the same as they were the last time you spoke, right?
Yeah.
But hopefully they're continuing to improve. And it's an opportunity for us to reflect on, okay, how are we doing on these things, right? The priorities change a lot more, but that also gives me some insight in terms of where they're focused, and it's an opportunity for them to ask me for help if they need something too.
And are you someone that retrospectively looks inwards frequently as a leader to think, oh, how can I improve? Or is it something you've accrued over time from just life experience?
I think that every successful person has to have a growth mindset.
Yeah,
right.
Agreed.
We all have
comfortable failure.
Absolutely, and with feedback, right?
Yeah.
But we all have certain strengths and traits, but most of those are acquired, right? And that means that they're modifiable. And I'm constantly looking for opportunities to continue to grow. I have a lot of mentors. I've had them throughout my career, and I attribute a lot of my success to my mentors, starting with my father, who was an incredible human being, and he was a tough dad, but he made me who I am. Mm-hmm. And I think constantly looking for what could I be doing to be better, to grow, and having people around you who have the courage and you trust enough that they can tell you, hey, you're screwing up, or I think if you did this would really make a big difference. And I think about one of my mentors is the chairman of my board now. and we're very close. And he's not hesitant about telling me when he needs, I think, that I should do something differently. And I appreciate that, and I embrace it. It's not always easy to hear, right? But he's helping to make me better.
Yeah.
And trust is really important in those relationships, right? Because when he says, Frank, you need to change this, right? I know that that's coming from a place of love, that he's trying to help me be successful. He's not just saying that to be a jerk, right?
And you mentioned the mentors. So you said that you had that your whole career.
Yeah.
So is that different mentors for different aspects, or is it just an evolution of different people to take different things from?
Well, so I think about mentorship as falling in three broad buckets, right?
Yeah.
I think that people often have skills-based mentors, right? I'm good at X, you're not good at X. You come to me and say, hey, will you teach me how to do X, right? I want to learn how to play tennis, right?
Yeah.
That's a form of mentorship, right? Then, I think some people have the sort of advocate mentors. We call them sea daddies in the Navy. The guys who are sort of promoting you within the organization. I'm not a big fan of that. I want to get ahead based on
you mean without basis or something?
Not necessarily without basis,
Okay.
but someone senior in the organization who's sort of pushing your agenda.
Yeah.
I want to get promoted on my own merits. And if something happens to that person and they're seen as your sea daddy, that can be pretty damaging for you, right? So I don't encourage people to do that. And then the third is this sort of trusted advisor mentorship. And I think those are the most important, most valuable mentorship relationships, but they're also the most difficult because there does have to be a pretty high degree of trust between the two individuals. And so it tends to happen organically. And I've been lucky throughout my career to have gotten to know people who were more senior than me, more experienced than me, and as we developed the friendship, I started asking them advice. Or in some cases, I think back to one of my mentors early in my career. He reached out to me and said, "Hey, I see some real potential in you, and I want to help you with your career, and I'm going to give you advice."
Really?
And that was brilliant. And as I reflect on my career and why I've been successful, and coaching that I give to people now that work for me or who I mentor, a lot of it comes back to what he taught me, which is when you're thinking about your career, asking what your next job is going to be is the wrong question, right? You want to think 10 to 15 years down the road and say, where do I want to be in 10 to 15 years? What are the experiences and skills expected of someone in that target role 10 to 15 years from now? And how am I going to acquire those skills and experiences over the next 10 to 15 years? And you develop a strategic roadmap for your career that gets you from point A, where you are today, to point B, where you want to be in 10 or 15 years. I've managed my career since my late 20s that way when he taught me how to do this. And I think it's made all the difference in my career.
So if you don't mind me asking, how old were you when you joined the industry?
I was 28. Yeah, when I joined the industry, yeah.
Okay, so you were in the Army for...
Navy,
sorry, for 10 or so years, yeah. Wow, that's an incredible ascent, isn't it?
Yeah.
And did you find, what do you find the differences between big pharma, mid pharma, and the personality traits that suit in those different environments?
Well, that's a great question. Most people in small to mid cap pharma companies, biotech companies came from big pharma, right? I would say. Big pharma is a great place to learn the business of pharma. They have a lot of programs going, they have a lot of resources, they have a lot of processes, a lot of more experienced people that you can learn from. Smaller companies, there's just a lot less people, a lot less experience, and so you have to really be pretty competent when you show up, right, at a smaller company. But the flip side of that is smaller companies are obviously a lot more nimble, I think, in general, and there's more of a risk-taking environment. Most biotech companies are pretty binary, right? The drug works or it doesn't. If the drug doesn't work, you go out of business. Yeah. That doesn't happen at a big company, right? That happens all the time, big companies, and they have other products and lots of revenue and things just continue on. People who do well in small companies, I think the characteristics we certainly look for, especially someone coming from big pharma and small pharma, are people who are very comfortable with high levels of risk, right? Because if the company goes under, you lose your job. Mm-hmm. And some people just can't handle that level of insecurity. And they either never leave the big companies or they go back. We've had some employees who went back because they just couldn't take the pressure of, are we going to be here tomorrow? And then I think people who are sort of problem solvers, right? when I was at Amgen, I had a large staff that worked for me. And, on any given problem, I could say, hey, guys, here's the problem. Go fix it, right? When we started Arcutis, there were 3 of us. There was no one to delegate. You did everything yourself. I used to joke that CEO stood for Chief Everything Officer. IT, finance, HR.
IT's always there.
Yeah. It was the meeting planner, the travel agent, everything, right? Because there was no one else to delegate to. Yeah. And you have to be comfortable with rolling up your sleeves and just getting it done, regardless of your title.
Yeah, I've said this before actually on the podcast. There's indicators when people won't suit a biotech environment. If they obsess over title and responsibility, that's usually one of them.
Yep, that's bad.
It's a binary view of what the role actually entails and what it's like.
Somebody asks how much staff I'm going to have. That's a bad sign. Yeah.
Yeah, and I feel like if they obsess over what happens if their role responsibility, or can I see the job description? Can I analyze it and break it down? Usually the people that like biotech are motivated by the journey and the story behind the company, which is also why it's so important to be able to articulate that properly to the candidates, I think.
That's a good point.
Yeah, whether it's the benefit or the scientific value proposition or the leadership, which is also usually a key motivator. It's probably a bit different for you guys now because you're established. You've got a great brand in Derm, but I imagine when you first started, that was a bit more important.
It was a lot more challenging at the beginning. And I think on the scientific vision thing, I think that's very important. I think that the majority of people that I know in both big pharma and in biotech really are motivated to some degree by the mission, right? I think most people that I've worked with in the industry really are dedicated to helping patients who are dealing with diseases, right? And if you can help them understand how your company is going to make a difference in the health system, how it's going to help people with diseases, they're going to get on board, right? People don't get excited about little ideas. You give them a big idea, something really, crazy and audacious, like, treating Alzheimer's. People will get behind that, and they will work really hard to make it happen.
Yeah, that's such a good point. I think a lot of small businesses can get stuck in not having that and not having a clear ambition and making sure it's tangible, or they go too big. Yeah. You know what I mean? It's unrealistic at that stage of the development of the company.
It's one of the privileges that we have in healthcare, right? Is that what we do is inherently valuable.
Yeah, and I find it fascinating that you've got 7 dermatologists across that level of staff. It still sounds lean to be commercial stage. Should you is that because people work hard?
Well, yeah, we don't have unlimited resources, right? We don't have a multi-billion-dollar product that's throwing off cash so that we can get fat. But I do believe that there is some inherent value in being a small, lean organization. Definitely. I don't know if you're familiar with the Dunbar number.
No.
So fascinating research from the UK, right? As a sociologist at Cambridge, and he spent his life studying primate societies, and they noticed that the size of a primate society was directly related to the size of a primate's brain. The bigger the brain, the bigger the primate society. And they wondered whether that applied to Homo sapiens as well, so they started studying it. And they discovered that it's true that human beings like to organize themselves into groups of about 150 or less, because that's the limit of personal connections that you can maintain regularly, right? And that's known as the Dunbar number. And what they've shown over the research is that across time and across societies, this 150 number is pretty consistent.
Oh, wow.
And we actually run our company with the Dunbar number in mind. Now, we're 2x the Dunbar number, but we think about that and we manage it as 2 separate groups of about 150 people. I don't want to be 5,000 people, right? I couldn't know all my staff by name if I did that.
It's a different environment, isn't it?
Completely different.
Yeah, it's not one. Neither's better or worse. It's just different.
It's just what I choose to do.
Yeah, exactly. So what's next for Arcutis then?
So we have 3 products now approved by the FDA on the market. Thank you very much. And 2 approved in Canada. We're expecting a 3rd in Canada very soon. We have an upcoming approval date in the United States for a 4th, and then a 5th product a little bit later this year. And then we have a pipeline of follow-on innovative assets that we're also developing. And we're always looking for new and interesting assets that we can add to our portfolio of products. And there are a lot of unmet needs in dermatology, medical dermatology specifically. Innovation has picked up in the last number of years, but it for a long time it was a neglected therapeutic area.
Yeah, it's amazing that, isn't it?
Yeah,
That's
it's been a real change.
But it's definitely a massive area right now in terms of
really
investment
is.
growth.
Yeah, and so there are a lot of people who still need better options, and that's why we exist, is to find those options for them.
So do you have your own proprietary platform as well, where you develop molecules through your own?
We don't do discovery at
you
Arcutis.
acquire?
We only do development. Having come from Lilly and Amgen, there's a lot of risk in the discovery side of things, and you can burn through a lot of money fast.
Yeah.
And there are a lot of other companies that do it well, and so we have just relied on other companies to do the discovery piece, and then we acquire the asset and then develop it.
And do you acquire them? Is there like a formula? Do you acquire them at late preclinical or phase 1? Or?
The products that we have thus far, most of them we acquired an active ingredient, and then we developed a topical drug to deliver it, right? And that's one of the benefits of dermatology, is you can do most things through the skin instead of through the mouth or an injection. We do have an injectable product. We actually bought a company from Cambridge,
nice.
A very innovative little protein engineering company that had a drug that we thought was fantastic, and so we bought them and incorporated them into the company. So we've had to do some development work on that as well on the front end, making sure the formulation was right and it was stable and so forth. And then we do all the clinical development, the regulatory work, the manufacturing work, and now we have a commercial organization to commercialize our products as well.
It's exciting.
Yeah, that's been a lot of fun. Yeah,
it keeps you engaged. So what keeps you going? Because you're someone that's accomplished a lot in your career. So what's the...
Yeah, I mentioned my father earlier. My father passed away about 15 years ago, but he drilled into my head from a very young age. He was a cardiologist. That you should, he's a physician. You should leave the world a better place than you found it.
That's nice.
Right? That was the guiding principle of his life, and I've tried to follow that my entire life. And the main thing that keeps me going, and the thing that gets me fired up, really energized, is making a difference. When I come to a meeting like this, and I'm at the American Academy of Dermatology right now, and then talk to clinicians who are using our products, and we hear the stories and see photographs in many cases of what our drug has been able to allow them to achieve with their patients. Yeah. That's the most motivating thing. Yeah, it really is.
Do you ever get letters from the patients themselves?
I do. They're emails usually these days.
Sorry,
yeah.
Carrier pigeon
but yeah, we have a general inbox at the company, and we get pretty regular emails
That's amazing, isn't it?
folks. It is.
Yeah.
And we have a lot of staff members who either are on our product or who have family members on our product as well. These are very common diseases that we're treating. Psoriasis, there are about 10 million people in the U.S. with psoriasis. Seborrheic dermatitis, about 10 million as well. Eczema, 25 million people. That's a lot of people if you think about it in relative terms. And so, you meet people all the time that are struggling with these diseases. And so we hear it personally. Yeah.
And what's your view on the future of dermatology?
I think that dermatology is really in kind of a golden age right now, right? There's been this explosion of new science and new research, and some of it drafting off of other things that are going on in the immunology and inflammation space, but some of it specific to dermatology as well. If you think about, I worked on Enbrel 20 years ago, for example, and we used to measure our success by a 50% improvement in symptoms. How many patients got 50% improvement in symptoms, right? There are products on the market now where over half of patients have 100% improvement in symptoms for the same disease, right? And that's in 20 years. That's an incredible amount of progress. So I think that we're going to continue to see people being able to live really full, happy, unimpeded lives, even though they have dermatologic conditions with the innovation. And by the way, that's happening all across medicine, right? And you think about, I had a very dear friend who passed away just before Christmas, but he had metastatic melanoma for 15 years. They'd given him 6 months to live when they diagnosed him 15 years ago.
Really?
And that's because of the innovations that we've seen in oncology in the last 20 years. Many diseases, types of cancer that used to be a death sentence, a lot of people survive with. Ones that had 50% survival rate, almost everyone survives. Breast cancer, testicular cancer, these are incredibly treatable diseases now because of all of the innovation that has come out of biopharmaceuticals.
Thank you so much. There's genuinely, that was inspirational. It was amazing to really hear the insights from your career and the learnings that you've generated, not just from the industry, but also obviously from the military background. And I think one thing that stood out to me is the use of mentors and actually identifying them in your life. Not prescribing someone necessarily even paying for that. It's just identifying people that are in your environment that you can learn from.
Who you like and trust, and who like and trust you.
Yeah,
right? That's the most important metric. Yeah.
And for the listeners, if they wanted to reach out to you directly, just to kind of get advice or touch on a specific point, is there a specific way that you prefer that?
LinkedIn is probably the best way. I think that's how you and I connected.
Yeah, absolutely.
Yeah. A pretty active LinkedIn user.
Great. Well, thank you so much, Frank.
It's been a pleasure.
Really appreciate it.
Really enjoyed talking with you. Yeah.
And be sure to subscribe for the listeners. And thank you.
Thank you. Appreciate it.